Welcome to our channel. In this video, we will see, what is in vitro fertilization. Half a million children are born each year around the world through in vitro fertilization. But do you know what it is, how it is carried out, and its possible risks? In vitro fertilization involves fertilizing an egg with a sperm outside the mother's uterus. This process, which is carried out in the laboratory, makes it possible to start a pregnancy for couples with fertility problems. Louise Brown, daughter of Leslie and John Brown, is the first person born through in vitro fertilization (IVF). This happened on July 25, 1978, at Oldham General Hospital, Manchester, England. Since that time, more than 8 million babies have been born worldwide, thanks to this technique, according to data compiled by the European Society of Human Reproduction and Embryology presented in 2018. The name, in vitro fertilization, originates from the first tests carried out in the 70s, when the fertilization of the oocyte was carried out in laboratory test tubes. For this same reason, the first children conceived through IVF were called test tube babies. When is in vitro fertilization used? IVF is generally used when other less invasive fertilization methods, such as hormonal treatments or artificial intrauterine insemination, do not work. This can be done with the couple's eggs and sperm. Or, donors can be used if one of the couple has infertility issues. The most common cases of infertility that can be remedied with in vitro fertilization are damage to the fallopian tubes. They make it difficult to fertilize the egg. If there is an obstruction, it makes it impossible for the embryo to reach the uterus, preventing pregnancy. Ovulation problems. There is not enough egg production. Fibroids. Tumors in the lining of the uterus that make it difficult for the fertilized egg to implant. Endometriosis. Uterine tissue grows outside the ovary. Ovarian failure. When the ovaries are not producing enough eggs. Genetic issues. When the man or woman has one or more congenital diseases, which they could pass on to their children. Seed problems. The sperm count is low or has reduced mobility. Ligated fallopian tubes. When the woman is sterile, in vitro fertilization can be a way of conceiving. Preservation of eggs. If the woman is receiving treatment that affects fertility, she can keep her eggs frozen for later in vitro fertilization. How is in vitro fertilization carried out? Preparation. Before starting in vitro fertilization, doctors must perform numerous tests to verify that the woman and the man are able to fertilize through this process. These tests include disease detection, semen quality testing, female ovarian reserve, evidence of embryo transfer, and uterine cavity exams. Once the test is positive, the woman undergoes treatment to stimulate the eggs and for the subsequent maturation of the eggs. After 2 weeks to a month of preparation, a vaginal ultrasound and a blood test will be performed to prove that the body and the eggs are ready to be fertilized. Then, at that time, an injection of the hormone HCG is administered, which induces the maturation of the egg. 36 hours later, we can start the process. Obtaining eggs. The extraction of the egg is performed through a puncture performed in an operating room and under anesthesia. The process takes 15 minutes. For extraction, an ultrasound probe is inserted into the vagina. Next, a fine needle is inserted into the ultrasound guide until it reaches the follicles, then the eggs are aspirated through the needle. In the event that a vaginal ultrasound cannot be performed, laparoscopy is used, which is a small incision near the navel, through which a needle is introduced which will extract the eggs. Fertilization. Once the human eggs and sperm have been obtained, the process of in vitro fertilization begins. Thus, the semen is obtained beforehand by masturbation. In complicated cases, it will be through testicular aspiration, which consists of the extraction of sperm, directly from the testicles using a needle. With IVF, the eggs are mixed with the man's sperm in a place of culture with a maternal serum similar to that found in the tubes. In addition, another process is an intracytoplasmic injection, which involves injecting a sperm directly into each egg. The embryos resulting from fertilization are analyzed daily and selected for transfer to the uterus. Embryo transfer to the uterus. Between 2 to 6 days after fertilization, the embryo is placed in the woman's uterus to begin pregnancy. This process is performed by inserting a catheter through the vagina to reach the uterus. Thus, one or more embryos are injected into it. This process is followed by ultrasound. If fertilization is successful, the embryo will adhere to the walls of the uterus. The success of fertilization can be determined after 11 days. Thus, it is from this moment that we will follow a normal pregnancy process, with periodic monitoring of the gestation. Unused good quality embryos are stored cryogenically so that they can be used later without having to repeat ovarian stimulation if another pregnancy is desired. Embryo conservation protocols vary according to the laws of each country. Possible complications and risks. The success of in vitro fertilization varies depending on many conditions. In developed countries, the average birth rate between 41% and 43% of women under 40 is calculated for each IVF process. Then, in women over 40, they are reduced to 18%. The American Pregnancy Society warns of the following risks. Possibility of multiple pregnancies caused by the stimulation of fertility and the implantation of many embryos. This involves the risks of premature delivery and the very low birth weight of babies. Spontaneous abortion rates slightly higher than in normal pregnancy, especially in women over 40. Infections of the vagina, kidneys, or urinary system due to errors during the puncture. This is not frequent but can happen. Pregnancy extra, uterine, which is the implantation of the egg outside the womb. In addition to this, it is possible to see side effects, such as light bleeding during the first days of pregnancy, nausea, vomiting, or diarrhea, or constipation. A gynecologist must monitor them. Generally, they do not involve any risk. Thank you for watching. You can watch more videos by clicking the links in the description. If you like this video, give it a thumbs up and share it with your friends.